Good afternoon and welcome to the last webinar Wednesday of 2023. Today we are joined by Matt Cannell, Senior Director of Professional Services at Contact.io. Webinar Wednesday would like to thank our sponsor, Contact.io. Contact.io optimizes processes and resources by revealing how patients and equipment move through the care delivery. Using AI, IoT, and RTLS, Contact.io helps health systems uncover waste, streamline capacity, improve workflows, and make staff and patients feel safer, seen, and valued. Their asset management solution enables users cases such as device search for patient care, preventative maintenance, PAR level management, and loss prevention. The cloud-based IT-friendly platform can easily scale into other in-offerings such as staff duress and patient elopement. So for more information, please visit contact.io. Just a quick reminder to save the date for our 2024 Spring MD Expo. We're headed to the M Resort Spa Casino in Las Vegas from April the 7th to the 9th. So please join us for 3 days of education, networking, and the latest advances in medical technology products and services. For more details about that, please visit mdexposhow.com. I also want to remind you to cast your vote for our first annual Tech Choice Awards. The Wrenches, as they are known, are the first awards that are 100% nominated and voted by the HTM industry. Voting is open through January the 12th, so please visit onetechnation.com/Tech Choice Awards. Now, today's webinar is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Let's kick off today's webinar by giving away one of our Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. In Charles Dickens' novel, A Christmas Carol, what was Scrooge's first name? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll be wrapping up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. As I mentioned earlier, our presenter today is Matt Cannell, and he will be discussing the top 10 RTLS questions Biomeds should ask in 2024. So Matt, you may begin whenever you're ready.
Awesome. Thank you so much, Linda. Just sound check, you can hear me okay?
Perfect.
Excellent, excellent. I always like to start with that. So good evening, good afternoon, good morning, perhaps, wherever you may be listening to our webinar today. Thanks to Linda, TechNation, Webinar Wednesday for having me back for my second time this fall. I'm excited to be back. My name is Matt Cannell. I'm based in Richmond, Virginia. I've been in the United States for about 20 years. And for that entire time, I've been part of healthcare RTLS. Prior to that, I was in Europe doing other RTLS-based technologies. But the last 20 years of my life, I've been here in the US, focused on US healthcare. A large portion of that 20 years was working for a large company before I joined Contact.io. And I'm excited to say that I spent 14, 15 years working closely with Biomeds, one of my favorite personas in the RTLS world. So I'm excited and privileged to be able to speak about not just a persona that I understand, a persona that I really love. But yeah, just welcome and thanks for being here. Today's kind of interesting. I've been given 10 questions. I've had a sneak peek at them quickly. And I'm going to walk you through the questions, and then I'm going to talk you through the answers. I'm really hopeful that we get to the end of the session today, and there's some questions. There's nothing better than live Q&A. So I'm going to take my time walking through these questions. I'm going to answer them in the best way I can formally, but I'm going to sprinkle in some industry experience along the way. which hopefully is good in the form of a story as I go through some of these things. So without further ado, let's get into it with question one. The first section of the webinar today, we're calling it selection. It's about selecting RTLS technologies. And as a biomed leader, what are some of the questions that you should be thinking about as maybe you're making evaluations on RTLS technology? So the first question one, what are the advantages and disadvantages of different RTLS technologies, such as active technology and passive technology? So first, I'll start by saying I love this question. I've been lucky enough to implement lots of both. Two fundamentally different technologies, and quite frankly, often misunderstood, I would say, based on accuracy, based on cost, based on use case, perspective, etc., etc. There's loads of ways to break it down, but at the core, active technology and active tags have a battery. They constantly chirp information to infrastructure that's listening. Passive technology does not have a battery. It's energized by some other technology that it passes through so that it can then wake up and chirp. So it's not chirping all the time. Fundamental differences. Often people get stuck in, well, passive tags cost cents. That's true. And active tags cost a bit more, and you need to change the batteries. And we'll talk about batteries when we're all the way down to question 10 later on today. But fundamentally, these things are very, very different. I would say active infrastructure to listen for active tags is actually cost effective to install across your hospital, wall to wall. And passive is not necessarily cost effective to do that across your entire hospital. With passive, you really create like choke points. Think a security door, or commonly in retail you see gates at the doors of Target or Walmart or a retail store, and items have passive tags on them so that they can be energized and create an alarm as you go out the exit. That's what passive choke points are. But fundamentally, active technology, I would say, is provides real-time location, right? It's truly RTLS. And importantly, I would say as well, active technology can provide multiple use cases. So you can start with a singular use case with the same infrastructure. Let's say asset tracking, right? This is a biomed webinar today, so let's focus heavily on biomed and assets. But then maybe the business may decide to add staff safety, the ability to have staff wear a badge and press a button in a duress event or something like that. But fundamentally, that same technology and those use cases can ride on that same infrastructure that you've put in place. Pass is very good. I would say single use cases, right? It can trigger an alert if a thing gets to a place where you want an alert. My retail example is a really good one, and it can work very, very well. But again, it's really about small pockets of location versus wall-to-wall coverage, which I think is important. I've seen systems where Biomed have installed passive labels on assets. It works wonderfully. However, to go and do an inventory, and you see people in retail as well, that's why I use that example all of the time. You have to walk around with like a manual scanner, an RFID scanner, and take a point in time reference of where that asset is. And that's great in that moment. But as we all know, things move quickly through the healthcare system. And therefore that point in time isn't relevant quite quickly. So if you want to know where things are all of the time, in real time, that's where I would say that active technology is useful for the use case of real-time location for asset tracking versus passive. Both are very good. That's my perspective. Let's see if that raises any questions at the end, because I'm sure it will. Okay, let's move on. Question 2. How can I ensure that my RTLS system is compatible with my existing IT infrastructure? Great question, and it is critical. In this day and age, it's critical. Frankly, all good RTLS systems that you're thinking about, looking at, investigating, should be compatible out of the box, right? They should be continuously, RTLS systems should be continuously evolving against IT and technology. They should be keeping up all of the time. Now, it's well known that a lot don't. But it should be easy to integrate any RTLS system to IT. This should be an open architecture of APIs, open ability to transfer data to and from. These should be out of the box experiences that you should expect. So you should ensure by leveraging what I always call a trust but verify standard. You're going to hear everybody tell you that it's easy and it's all possible and quick call and we'll just do this. I'd say, okay, great, let's try it. Let's give it a try. A good example, and I'm not going to reference my company all that much today. I work for Contact.io. I lead professional services, which means we do implementations, everything from project management through tech support through customer success. But you can go to developer.contact.io right now and see what you should be expecting from any provider from an open API landscape. It should be easy. It should be there for you, served on a plate, so you can do these things. Again, ensuring everything is open, simple, and available. You should expect full access to data, the system, the health of devices. You should be able to take as little of that or as much as that as you want. There should be nothing hidden. So you need to expect that you can get access to everything and anything that you want. And it shouldn't become some new project to implement and integrate and the like. With Contact as well, integration is kind of cool because dependent on the level of the Wi-Fi system that you may have, we are already integrated into those Wi-Fi networks. So tags that we have and systems that we put in can ride directly through a Wi-Fi network and not have to have some middle device that takes BLE signals and traverses that into the Wi-Fi world. So again, summary on this question, should be easy, and you should expect it to be easy. All right, let's keep going. How can I future-proof my investment in RTLS? Well, if you're selecting the right vendor and the technology is compatible with your IT infrastructure, it's likely you're already making a good choice, especially as it relates to future proofing, I would say. I would take a good look at the roadmap of RTLS needs. Don't just focus on what you think you need today. Focus on things that you want to implement, not just ideas that may never happen, things that you really want your roadmap to look like from an RTLS perspective. That's how you future-proof. You don't want to get in with use case one and then figure out that what you've just implemented cannot be leveraged for use case two. My example of asset, then staff, then maybe patient, then maybe hands is a good one to think about. So consider your own roadmap when you're making selections and thinking through how you're future-proofing that investment that you're going to continue to use over time. I would say IoT-based RTLS infrastructure needs to connect directly to the cloud. It needs to talk directly out to the cloud. No need for IT projects to build servers, computers in data centers, using power and using cooling just to aggregate data and to send to the cloud. You should ask questions about that. The devices to the cloud is important. And becoming more and more common, but you don't want more and more things for IT to do. That's just another way to future-proof. I think that when you want to add more devices too, you've got to think about, when I add more devices, are there any other things, is this infrastructure scalable? If I want to add a new building or add a new department or what have you, are there any kind of gotchas that I'm going to have to add something, or I'm going to have to do these things. So understand, is it scalable? Can I keep adding devices, or are the extra costs or things like that? So these are good questions to ask. Make sure that it's scalable. It has to be scalable. Um, um, I think that's all I'll say on that question, actually. Let's keep moving. Um, Question 4 moves us into an implementation section. Great question. How do I minimize disruption of my operations during the implementation? I hear this all the time. Um, I have a very kind of a strong opinion on this. Um, a well-run RTLS project should not disrupt operations, period. It just shouldn't. So minimizing it to me is somewhat foreign, because it just should not do that. If an RTLS project that maybe you have is disrupting operations, something's wrong. There are common mistakes that suppliers can make. A great example, and something that I practice at my company, is just putting lots and lots of people on site because you're trying to go fast isn't the way to go fast. Having technology and tools that enable less people to implement fast is the way to go fast. Putting lots of people on site to go fast is disrupting operations. The healthcare setting is already too busy, and the healthcare environment doesn't need more and more and more people. It especially doesn't need teams of people pulling cables and things like that through the ceiling. That's becoming almost impossible to do these days anywhere. But again, having too many people on site is a problem. Um, I'll give you a great example. I promise stories. We just finished a 750 bed hospital in less than a month. I had 3 people. So it was 3 people implementing our product in less than a month. 750 bed hospital, big, think, multi-building, multi-campus. It's about 10,000 devices all in, probably infrastructural devices 1,000, and we tagged 9,000 things. But we did that quickly. We did that quietly because we have really good tools that enable us to do that. So thinking through, when you're thinking about questioning the RTLS investment, understanding the tools that people are going to use and how many people are they going to bring on site is certainly important to me, and certainly worth sharing. Just to keep going on the story, I had a call from a healthcare system the other week, and they were confused. They called me and they said, "Matt, we're a little confused. As you know, we've done a bunch of these projects in the past, and we used to getting complaints that your guys are in the way, or the team's in the way. The project groups just, they keep doing these things that nurses are complaining, and et cetera, et cetera." And with the projects that you guys are doing, we're just getting compliments. The guys are actually really nice, and the guys are actually really helpful, and they're not in the way. We hardly even see them, but we see it getting done. And it's just the way we treat vendors. It's just the way that providers can treat vendors. We got to treat our install providers and vendors and cable guys and things like that. I don't use cables, but as part of the team, and not like a vendor is just doing work for us. And that's something that that I believe in. Anybody that does work for anybody on my team goes through an etiquette program, learns how we want this to go and the quality that we expect. Question 5, halfway through. How can I integrate RTLS data with my existing healthcare information systems? Okay. We kind of touched on this earlier in the selection, question 3, but I'll go over it one more time because I think it's important. An open API architecture that anybody can access, that's easy, available, online, has examples, has tools, all those things that's available for people to use is critical to success. I see people all the time being able to take data from our system without us even actually having a conversation. It should be very, very easy. A question that we get asked a lot, I've heard for years, is, so how long is it going to take? how long is an integration going to take? Because IT is busy. Well, I'll tell you that every IT department that I've ever met certainly is busy. They're really busy. They've got a lot of important things going on. Um, I always recommend the same thing. It's quite straightforward, but it seems to always work. Is we need to talk to IT really, really quick. Upon decision to put an RTLS system in, let's get our IT in the room very, very quickly and just explain the simplicity of what we need them to do and by when. Um, it's obvious that they'll have to schedule that. It's obvious that there'll be something for them to do. But going all the way back to a previous question too, it should be easy. It should almost be plug and play for IT to be able to take data from a good modern system with little or no help. Maybe read a quick document or an article online, and then they can actually, because their IT people are extremely intelligent, they can quickly start these integrations going. So how? Through APIs, open APIs that are available for everybody. How long does it take? Well, it should be quick. And if it's not quick, and if these things become a project, that should be a red flag of how easy it really is to work with that supplier. Alrighty. What level of training is recommended for healthcare staff using RTLS technology? Okay. I prefer ongoing education versus training. And I think the level of training and the frequency of training is really based on role and an intended use case. My opinion, gone are the days of, hey, at the end of the project, we'll do a quick round of train the trainer and hope that that works real well. But getting up front in a project and getting the education director involved and having an ongoing program where education is just available should be expected from your provider. The reason it should be is because, going back question over question, if you've done good selection of a vendor, if that vendor is keeping up to date with modern technology, if that vendor is making it easy to integrate with IT, plug and play, if all those things are true, then they should also, because they are clearly evolving often, fast, quickly, based on customer feedback, based on your feedback, based on industry feedback, they should continue education throughout the length of the agreement while that RTLS system is in place. Doing something at the end at go live is great that day. But if that vendor truly is doing all the things that I said, they will have things to talk to you about on a very frequent basis. I meet with groups of people across the country weekly. My team meets with groups of people across the country weekly as well, just because the rate of change and the things that we're evolving and the way things are changing and dynamically updating, you need to have that continuous education. So the level of training depends on the person. It depends on what you're doing. Is it a complex use case? Is it a simple use case, etc.? But it should also be continuous, in my opinion, because of that selection that you've made. It should just naturally imply that you need to keep that education going to keep everybody up to speed with what you're doing. Let's go down to the next question. Actually, let's just keep going on education for a second. I've got another thought. With Biomed, I've been lucky enough to work with Biomed for most of my career, quite frankly. And what I found with Biomed and the curiosity of the Biomed is that keeping them involved throughout projects, keeping them educated, is just an amazing way that new ideas are formed. Biomeds are curious by nature. They're super intelligent and they're the heart of the hospital, in my opinion. And they have come up with so many ways, and I've discussed so many ways to use RTLS and in just different ways and just innovative ways. So spending that extra little bit of time with Biomed, if you're not feeling that you're getting that touch from your provider, then I would suggest that something's not right there, and you should get that certain level. Question 7. All right. What are the typical challenges of implementing an RTLS system in a healthcare setting? Well, there are some. I'll just state the obvious. Hospitals are busy places, and the concentration of the people working in the healthcare system needs to be on patients and the care of patients. Um, the RTLS team needs to be fully aware of that, right? And if they're not, that's an issue. They need to be able to navigate swiftly through your hospital and be as non-invasive at the patient level as possible. We also see, and I think this is probably fair to say of most hospitals, whenever we go to a hospital, I'm working in hundreds right now. Everything's changing. There's a constant rate of change. There isn't a hospital that I'm working with right now, and it's lots, that isn't doing some change projects. It might be one room moving from something to something else, or it's a new tower being built, or a new parking deck being built, or a new department, or 6 East is moving to 7 West, or all those things. You've probably heard that a million times before. And the software tools for the RTLS system need to be able to handle that, not just at the initial installation, but post go live, things are going to change again. So the challenge that I'm referring to here is just change. And as you're thinking and asking questions about RTLS, you need to be ensured that the provider and the system that you're implementing can change too. More importantly, can you change it? Now, sometimes you might not want to, or you might be too busy to do that, and you might want the provider to do that. That's fine. But at least have the ability where you can make simple changes yourself. It shouldn't be, you need an IT guy or a developer or what have you to change the name of the room, or add a room, or repurpose a department, or add a wing. You should be able to do those things yourself. Other challenges, I think just from a funding perspective, looking at a SaaS model, operational expenditure versus CapEx is another challenge. We find our SaaS model it works great and it really helps customers actually make that investment. Our installs are fast, they're easy, scalable, and you're not spending months, so you can get over the initial hurdle of the finance and then recognize the ROI super quick because of all those good things that I've talked about fast, scalable, and easy. And you should expect that from a good RTLS provider and system. All right, let's move on to, I think, the next section, continuous value. Let's dive right in. What are common KPIs for an RTLS system in a healthcare setting? Great question. Great question. Obvious statement, but KPIs are critical. There are far too many legacy RTLS installations in this country that do not have any form of KPIs behind them. They got implemented because someone managed to get it implemented. Maybe there was thrown technology at a problem without a great deal of thought or some other reason that there's no way to measure success. Going into any RTLS situation, any RTLS project, you first need to understand what the problems you're trying to solve. You must have problems that you can solve with RTLS. But also not only know what the problems are. My rental spend is too big. I can't be PM compliance every month. We're losing things through the laundry, specifically telemetry, etc., etc. Know what those problems are, but also it's important as we think about KPIs to be able to benchmark the current state. Very important, right? Because then once you implement the RTLS system, you can monitor your success against those KPIs and those problems that you've identified up front. And month over month or quarter over quarter or whatever cadence actually makes sense, you can monitor the return on investment as you go throughout the months and years. Thinking about Biomed for a second, I'm sure in a PM cycle it's easy to find the first few of certain classes in pump month. You don't really need a system for that. But once you get down to 20% to go and a week left, that's when the RTLS system is going to help you find that remaining percentage of things to keep you in or get you in to compliance, which is obviously for the people listening today really close to your heart. I can't remember how many times, it's a lot of times I've walked into a biomed shop. I always visit the biomed shop whenever I go to a hospital, and that's often. Where a biomed has had a big smile on their face, and it was basically because last month they hit compliance, they hit their numbers. And the smile was because they knew that without the system, without the RTLS, they probably would have gotten close, but probably not there. And there's probably penalties and things like that that they incur when they don't meet those targets. So it's pleasing. I think there's a lot of biomeds as well that probably think I did it during my nomming working hours and it didn't force me into an overtime situation, which I'd much rather be sitting with my wife and kids at home or husband and kids at home eating dinner. I had to work overtime to get extra PMs. So there's a certain level of satisfaction that can come from that as you continue to make your numbers. Let's think about nurses for a second, though. There are a lot of stats out there about how many minutes and sometimes hours nurses can spend just searching for things. And I'm very specific on the asset management use case here. It's wasted time. Time spent looking for assets is time not looking at patients, with patients, spending time caring for patients. Having assets in the right place, at the right time, in the right condition for nursing is likely a huge satisfier, not just for the nurse, but for the patient as well. And any extra time we can eke out of a patient's stay because of an RTLS should be, something that we're all extremely excited and touched by. All right, let's keep going here. What can I do to make sure my team uses RTLS in the long term? That's a good one. It's a good question. Well, it starts with one of the questions I mentioned earlier, actually. If your provider isn't continuously updating you on new things and checking in on educational needs and things like that, and you've got some turnover, you're naturally going to run out of people that understand how the RTLS system works. So that educational piece that I talked about for a while is really important. I also feel strongly that RTLS only works when people and process are involved. I think there's three things: people, process, technology. Technology is one thing, but having people and processes of how you use things and sometimes how you maintain systems too is critical to success to keep the system running long term. I also think that looking at that future proofing, question 4, I think it was, where you're looking at adding additional use cases on top of the initial investment continues to keep it going over time. I'm just looking to see, I'm just thinking of another idea, another piece of this. I'm sure there is. Yeah, okay. I knew there was something. So I recall a long time ago, and this was a really pleasing moment. I was down in Florida somewhere. It was really, really hot. And we was talking with the Biomed team and we was thinking through how do we manage, tags that come off of equipment? How do we, we want to send an asset for repair to its OEM, and we want to take that tag off so we don't lose it, but put it somewhere safe, so that when it comes back, we can put it back on. It's quite a simple problem. And this goes back to what I said about the curiosity of biomeds. I went into the biomed shop and they was kind of waiting for me, and they said, "Hey, come look at this." They'd basically built a closet that had an infrared device in there. We was using infrared just like we do at Contact.io as well. And you open the closet and it switched the infrared off so infrared wouldn't bleed out. And they had racks for these tags that they'd put in. But they made this closet into a location in the system that was called out for repair. So now if nurse X was looking for that particular asset, its location was out for repair. So it was just obvious where it was. So I'm a little off track on future proofing. I'm really talking about the fact that if you continue to think about how to use the system and you continue to evolve and do different things with RTLS, it keeps it ingrained in the culture of what you do day by day. All right, I promised there was a battery question coming. Question 10, my last question, and we're right on time. Amazing. How much battery maintenance and general infrastructure upkeep is necessary post go live? All right, so I'll just give you my opinion on this, and I think this is a modern approach to batteries. Battery maintenance should not be a thing. It should not be a thing. So questions that you're asking when you're thinking about batteries is not how long do your batteries last, which has been the common question for 20 years. It should be, do your batteries last the length of a contract? And what happens at the end of the contract when we renew? And the answer should be, you get more. We'll replace them. You shouldn't have to monitor batteries anymore. It's 2023. You shouldn't have to swap batteries. If you ever try doing that, it's horrible. It's not the thing you should do. You should have a battery that lasts the length, the duration of a contract, that meets the performance specifics of a use case, which is exactly it's exactly what we do. Other maintenance. Yeah, so I'll use a story and then we'll end for Q&A. One of my great friends is a biomed. I hope he's on this webinar. I don't know if he is or not, but he's down in Louisiana. He's called Andrew. He's a great guy, and he's taught me more than I've taught him for sure. But he figured it out that how powerful having an RTLS system was for his day-to-day job, his life, his work-life balance, most importantly, to help nurses and to help patients. He realized that sometimes things would get bumped, infrastructure would need some form of maintenance. So he built that into his workflow, a few minutes on a Friday morning, where he would just go and check some device that might have gone offline or something like that. Always is going to happen, because he realized how important that couple of minutes was on a regular basis to keep the system running, because that system was providing him the value that mightily outweighed those few minutes that he spent on other forms of maintenance. Hopefully that makes sense. And thanks, Andrew, for that one. Okay, Linda, I have finished through the 10 questions and I am ready and available for our live Q&A.
Perfect. Thanks, Matt. We've got a few coming here. The first one is, what are the accuracy and range limitations of RTLS systems?
Yeah, that's a great question. I'll move on to the last slide. I won't touch the slides again. We're in the live Q&A session now. Accuracy, great question. First and foremost, doesn't matter. Well, it does. What matters more importantly in the questions that you are asking is, what are the problems I am trying to solve? Based on those problems, then you can think about the accuracy requirements. If you want to find an asset pretty quickly in a 1 million square foot facility and getting it into the room or the room next door is good enough, you don't need inch level accuracy. So I would be very wary of jumping into the specificity of accuracy in the questioning before you've even thought through, what am I trying to do, right? The value, the outcome by solving the problem then determines the accuracy that you need. There are many different levels of accuracy. Get what you pay for type situation. I have a problem that I need to drive to the shops every week. I'd love to do that in a Ferrari, but I don't need a Ferrari. My Volkswagen Atlas is perfectly fine to get me to the shops once a week. The point is, you don't need the specificity for certain use cases. If you have use cases that do, it's a different level of accuracy, a different level of cost. I think Biomed assets going from I have no idea if this asset is still even in this facility to it's in room 101, and maybe if it gets it wrong, it's in 102. I think from a Biomed asset accurate perspective, I don't recall ever speaking to a Biomed that's told me that's not good enough. Hopefully that answered the question, Linda.
Perfect. Okay, so what factors should I consider when choosing an RTLS vendor?
Yeah, so I think an RTLS vendor should wake up as a company every day and only think about being an RTLS vendor. I think that everything that that vendor does should be all about location, all about RTLS, 100% embedded in every conversation. It's all they think about. It's all they breathe about, which is uh, a reason that I enjoy working where I do, because that's all we talk about. That's all we do. I also think that this needs to be credibility in the group that the vendor has assembled. Industry leaders coming together in the same place with different stories, some good, some bad, but having a core group of leaders that have been in this industry, which is somewhat small. We kind of all know each other, but having a bunch of them that have come together, I also think is very useful, right? So experience really counts in my opinion. It really does, in my opinion. But also, you certainly don't want to. We talked about this in future proofing. You really don't want a one-trick pony. You need to be able to add things and navigate your RTLS roadmap in the timeline that you decide. But you certainly don't want to go to use case 2 and decide, oh my goodness, I need to start that process again. You need to have a vendor that thinks about RTLS every day, lots of experience, can do a bunch of things, and is continually evolving. So I'm weaving this answer into all of the previous questions as best I can. But again, I hope that answered the question.
Okay, so how does AI factor into healthcare and RTLS systems?
AI, yes. AI is a big thing, and you hear about it all of the time. We've actually embedded AI into applications that we have where you can ask questions and the AI engine can give you answers. Uh, how often was this pump in use last week? Or where do I have pumps that are sitting in clean rooms for several days? A utilization question. I'm excited about using Bluetooth. I always have been as well. And maybe this is not necessarily AI per se, but I like the idea of kind of using mobile tools that inherently can listen to BLE. And wouldn't it be cool in the future if you're walking down a hall and you walk past an asset, you don't even know it's there, but it's overdue PM and your phone vibrates. So your phone's continuously chatting away, talking to the cloud and asking interesting questions. It's something that I think is a really cool kind of form of AI. We've used AI. We continue to look at AI. I think it will continue to evolve and as time goes by, and it's obviously a part of our future.
Oh, great. So how can I measure the return on investment of an RTLS system?
Yeah, good question. I touched on this a little bit, quite a lot actually, in the KPI question. And I'll just state it again because I think it's quite straightforward. In the questions that you're asking, you need to understand the problems that you're trying to solve. You also need to be able to benchmark the current state of those problems. I know that my rental bill month over month is twice what I want it to be. That's my problem. I know now how much it is. Now, by using the RTLS system to right-size inventory, move assets from in the right place, the right time, in the right condition from a biomed perspective, then we're going to be able to bring things, maybe sequester things out of circulation because we've seen them sit in certain soil clean rooms for too long, and then eventually take them off of contract and then look, does my rental bill go down? So I think it's all about understanding the problem, benchmarking where you are, and then continuously evaluating month over month or quarter over quarter or frequency over frequency so that you can continuously look back against the original problem statement and evaluate, am I doing better? Hopefully you are. And if not, then what else do I need to do to continue to drive those problems away?
Okay, great. We've got a kind of general question here about RTLS. Can you tell us what kind of data is available on RTLS systems?
Yeah, absolutely. Well, fundamentally, the RTLS data is about location. In the asset use case, I'm thinking very specific to the webinar here on Biomed. So you have information from a CMMS system that you all are familiar with. That's your asset record, your source. Now you're adding in valuable pieces of additional information, such as where it is and when it got there and where has it been and trending. It shouldn't be there and it goes there at 4 o'clock every Thursday and things like that. So fundamentally, sensor data from an RTLS system is location, and then what you do with that and the collection of that data and what you do with that from a historical perspective enables you to do a bunch of other cool things.
Great. Now, just before we wrap up, Matt, have you got anything you'd want to summarize with or recap?
No, I think that the questions were good and we managed to weave a bunch of them together. As always, if there are questions after the webinar, please reach out to us and we'll be more than happy to answer any questions, have conversations, etc., etc. It's not a problem, but no, I think we've weaved this together pretty well, Linda.
Great. Perfect. Well, thank you so much, Matt, for your time today and obviously a great presentation. I'd like to just encourage everyone to visit today's sponsor's website to learn more about the services they provide to the industry. So please visit contact.io. Also, as promised, the answer to today's trivia question, of course, is Ebenezer Scrooge. A quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. Of course, if you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back in January 2024, so please join us to help us celebrate the 10th anniversary of Webinar Wednesday. Visit webinarwednesday.live for more details of all the upcoming webinars and, of course, complimentary registration. If you've missed any of the past webinars, including those by today's sponsor, Contact.io, please visit webinarwednesday.live again to see our whole webinar archive. Just want to say thank you once again for your time today and obviously for your continued support. And I hope you all have a very happy Christmas.